Many roads lead to Rome, and it is all the better today to have a general practitioner, a specialist in general medicine, but with a complementary background and the need to really look at people holistically and empower them on the path to healing. And there is certainly a big key on the path to healing within oneself. I am delighted that he is here today. Boris Alexander Hörold, it's great to welcome you here with me in Switzerland today. And we have also found our way together through your knowledge and experience with the Kleinsche Fields. However, I would still like to hear your complementary approach and your thoughts on the subject of a healthy patient or having a healthy patient or whatever. What is really the important key for you now from your years of experience?
Well, generally speaking, it's that whenever you experience illness, it is primarily because you have not met the prerequisites for good health. Rest assured, I am merely here to inform patients about these prerequisites. I did not create them. Understandably, I am not divine, maybe not even semi-divine. Undoubtedly, I am not God, nor am I Mother Nature herself. But that is exactly where you should seek answers. Due to both my professional and personal experiences, I ventured onto this particular path. The impetus for this journey stemmed from my own history of illness and my persistent exploration of various remedies. Consequently, I found myself re-evaluating the necessary actions to achieve good health. These transformations can be observed merely by looking at me. From a distance, it was clear that I was suffering from illness. Severe skin problems plagued me, leading me to seek help from various doctors, including those at the university hospital in my registered town. Frustrated and desiring a different approach, I began contemplating the idea of exploring alternative therapies. However, I proceeded with caution, learning from past experiences where I had blindly followed every passing trend that made its way into the village each year. After a year had passed, I embarked on a journey of 5 or 6 hours across the country, traversing the 7 mountains until I arrived at Pirmasens to visit the 7 dwarfs. There, an alternative practitioner, in collaboration with a doctor, had developed a remarkable therapy aimed at enhancing cell performance and specifically mitochondrial function in individuals suffering from illnesses. The success stories and case studies shared within the therapist-exclusive section of his password-protected website left me astonished. Motivated by this discovery, I decided to adopt this therapy for myself. I began by making changes to my diet and incorporating micronutrients, but these alone did not bring about the breakthrough I was seeking. The pivotal moment came when I underwent chelation therapy, a process of eliminating toxic metals from my body. The above alterations result in approximately 1375 characters. So, infusion and chelation therapy.
You had amalgam fillings?
As I recall, the story goes way back to when I was just a young boy. At that time, I underwent a procedure to seal all my chewing surfaces, particularly in the molar area. Later on, in my student years, given my limited financial resources, I saw an opportunity to receive dental treatment as a patient in a clinic. They were subsequently replaced and reinserted, all done without the use of rubber dam protection. Furthermore, I also underwent some cast gold fillings. Additionally, I received a hepatitis B vaccination, which together created circumstances that nearly caused an overflow. I was unaware of the reasons behind my declining health. My ability to concentrate diminished and chronic exhaustion grew. On top of that, I experienced a high level of stress. I became a father twice while pursuing my studies, and I had to work in the nursing field to support myself. My relationships were also consistently stressful. So yes, stress was a factor, but I was convinced that there was also an underlying physical issue. And then I embarked on this journey, therapy concept on myself. I'm a doctor, which means I can prick small holes in my own veins and have fluids poured into them. When I did that, I suddenly realized, oh yes, I can do that again. The sun is rising again. I saw light at the end of the tunnel again, and I carried on doing that. And I was doing really well. I could hardly walk for strength almost. Then I had someone come to visit me. He had signed up to introduce me to something, and that was Mr. Klein Senior. And he told me that he was from Bremen and that he had invented something and that it would work with magnets. And I thought to myself at the time, oh God, so magnet stories, that's the kind of thing that
You on coffee trips?
people were convinced about the benefits of coffee trips. Then he suggested, why not take off your shoe and place it here? He held out a foil, a strip like this, and I placed it on there. It warmed up and even gave me a tingling sensation. However, I couldn't see any advantages for myself. That's simply my approach, where I only recommend to my patients what I have personally experienced. And if I fail to comprehend the purpose, reason, or benefit, then I tend to be reluctant. However, it was clear that he possessed integrity. His actions aligned with his promises, and he was not inclined towards exaggeration. On the other hand, he lacked the skills of a proficient salesman, but overall, he, all in all, likable. I then lost sight of that out of sight, but always managed to get back in because my colleagues, I had recommended to him to visit. They reported very positive things. In other words, they had been treating it with complementary medicine for a long time, and it was suddenly gone by sleeping in this Kleinsche Fields. About 6 months ago, I stumbled upon it once more as I faced a problem of rejuvenation. Thus, I underwent a personal regeneration process, had far too little energy, and I realized that I needed to recover after a long, exhausting time. I purchased a sleeping pad after watching a video about misses for the purpose of improving my sleep. Professor Koenig from Leipzig has a chair in biochemistry, immunology, and that sort of thing. And she also has a laboratory in Magdeburg. And there she is, one of the few people in the world who can measure cell performance. So how well are cells able to produce energy themselves? And when I saw that both in the test tube and in living humans, the ability to produce energy themselves can increase by up to 300%, and even mutated mitochondrial DNA decreased quantitatively, I thought, okay, you try that. Then I ordered one of these sleeping pads and saw that firstly, I am more relaxed, can sleep better, you can even meditate better on it. So it's a very pleasant feeling. And the rejuvenation process is enhanced after any form of activity. In line with this upgrade in cellular function, I have recently undergone the extraction of a couple of non-vital teeth. This was done by a dentist here in Switzerland near Lucerne, who went to great lengths to tap these old teeth where the roots are very caked. And you don't find that many dentists who take the time to remove them by hand in such a way that there is no swelling afterwards. With the assistance of both the Kleinsche Fields and an additional device I purchased to enhance cell performance, I was able to achieve my desired outcome. Recovered so quickly, that was impressive. A sinus lift had to be performed in the right upper jaw. This means that the floor of the maxillary sinus had to be raised so that these ceramic implants, which are a bit longer, could be placed there. Technically, you have a sinus infection, i.e. an inflammation of the maxillary sinus. I didn't need any antibiotics. I simply treated it with the Kleinsche Fields and with the device. After 2 weeks, I was completely pain-free.
It's really impressive to hear that right now the topic of the medical profession, where we also hear a lot of stories like statements, yes, it remains chronic and they stay ill forever and whatever. Teaching yourself what you need to learn? Was that perhaps also a way of recognizing what causes illness? What does it take to get well in the first place or whatever? Yes, exactly.
Yes, you don't know that. First of all, it's an inflammation problem and not just a problem on the skin, but of the whole body. And this systemic inflammation or silent inflammation is, in my opinion, the main problem in the vast majority of chronic diseases. Whether you take MS or cancer or allergies or rheumatism, it's always a silent inflammation problem.
It's also called violent
I
inflammation.
didn't want to say it in the new German way.
But we've already heard a lot about it. Yes, exactly.
Yes, and this only ever occurs when the natural living conditions of the cells are not fulfilled. In other words, if these living conditions are not met, our cells were created at some point 2 billion years ago through the merging of different types of bacteria. And the so-called host bacteria, where other bacteria crawled in, had already installed a kind of biological survival mode back then. This means that whenever the living conditions became even worse, this bacterium became larger, divided itself larger, divided itself larger, divided itself. What comes to mind? Diseases such as cancer, of course. But it can also be lipedema. It's inflammation in general. And nature has built this in so that as many of these bacteria as possible are still there when living conditions improve again. That's why it's survival mode. And if we know that every single one of our body cells originated from these types of bacteria and still has these functions today, then we can restore these natural living conditions if we want to treat them causally. And this includes anti-inflammatory nutrition. To enhance cellular fuel supply, it is necessary to optimize the intake of micronutrients, vitamins, trace elements, minerals, and amino acids. In cases of inadequate supply, suitable substitutes should be considered. It is also crucial to eliminate any substances that do not belong in the body, such as toxic metals like the fillings I had. However, I didn't experience any improvement after their removal. Only when I underwent chelation therapy to remove the accumulated toxic metal from my body did I start feeling better. Yes, that's so rough, and anything that improves cell performance makes sense. Anything that makes them worse should be avoided. When I was a little boy, I wanted to because I thought it was good. I waited for it once a week. Then these garbage men came. I thought garbage collectors were good. I thought working once a week would be great. But it's not like that. In principle, I'm also a bin man today because I help patients who have limited cell performance and are therefore chronically ill to dispose of this waste. Yes.
Very interesting. On the subject of healing, what does it take to really get well? What does a person need in their mindset, in their environment? We've just heard that on a physical level, we have your, yes, exactly, cellular ability and the whole issue. But what else is needed? You said earlier that something else is important up here.
I think that's even more important. If you imagine that such an atom consists of nothing but matter and vacuum of nothing, then we, as normal doctors who have simply learned to think in terms of this philosophical materialism, using unconventional and potentially ineffective approaches for chronic diseases may not be advisable, judging by the results obtained. The outcomes are notably unsatisfactory, particularly when it comes to chronic illnesses. Although medication can somewhat manage the situation and fulfill patients' wishes, it may not coincide with what I personally believe is medically necessary. To clarify, if a patient desires a certain medication, they are given it without hesitation. I do not express an opinion or entertain any doubts regarding this matter. Personally, I would not adhere to such practices, as anything that impairs cell performance tends to exacerbate silent inflammation and deteriorate overall health. Regrettably, these patients are already the most debilitated, typically the elderly, whose cells naturally function inadequately or worsen in performance. Consequently, when these individuals are simultaneously on medication and experience inflammation, a distressing downward spiral occurs. My responsibility is to reverse this undesirable trajectory if that is the patient's desire. However, it is disheartening to witness numerous sick individuals undergoing a comprehensive program. This program involves utilizing Kleinsche Fields for therapy, receiving treatments through a water matrix device, adopting an anti-inflammatory diet based on laboratory results, receiving infusions, and even undergoing lab therapy as necessary. And then they realize, well, something's working again. That doesn't mean that there is a lasting result, because the most important thing in getting well is what you think, i.e. the intention. An interesting question for a patient, which I often ask, is what would they do if they were healthy again? Super. And then it's like a disturbance, a question like that, because you've learned to use your mind, to chew on problems with your mind. So many people also ask themselves, why am I ill? And with why you generate answers which are simply justifications for something that doesn't work. And that's the way it is in life. Either you have good reasons or you have good results, because good reasons don't automatically lead to good results.
I would put this important topic in a separate interview if it were okay, because I think it really is such an important factor from your point of view as a doctor to hear what else is needed. Thank you for being here today, and I'm really looking forward to discussing this big part with you, where it's really about this one up there. Dear viewers, I trust that you have gained insightful ideas from this immensely valuable discussion published earlier.